Well, I had trouble with my left heel for, oh gosh, a couple of years, and it got to the point to where I could barely walk. I couldn't find shoes that would fit my heel without them hurting. I like to do stained glass, and I have to stand to do stained glass. You can't really sit. And it got to the point to where it hurt all the time for me to stand to cut the glass and take care of it. And I was really at the end of my rope. It was kind of like, let's do something here. I gave PCI a call, and I asked if I could get into Dr. McBride. My hope was that he would tell me that he could fix my heel.
When I met Susan, I knew that she was looking for further treatment because she felt that she had kind of reached a plateau with where she was. Her problem waxed and waned slightly, but we weren't making a lot of headway. And this is unfortunately the case sometimes when we've tried all conservative measures and we've exhausted them and the problem isn't getting better. Then one of the other possible ways to achieve relief of the symptoms is to consider surgical options.
From the very beginning, Dr. McBride helped me not to be so fearful about the future with my heel. He explained to me the surgery, what would happen.
I keep close contact with my patients, especially my surgical ones. I contact them before surgery and after surgery just to say hello, make sure that everything is going okay.
I've never, ever had a doctor call about, to ask how I was doing, and that just blew me away. I couldn't believe it. Some of the other services that I used here at PCI was the radiology department. And it was nice that I was already in the building and I didn't have to worry about going to another building to get this taken care of as far as the x-rays. Everything is under one roof, and it's very friendly. It reminds me of a mall in a way, but with doctors, and so I like that concept. I think that's cool.
Yeah, the advantages of us being in our new space, people have been able to streamline their day, and I know that husband and wife have had an appointment in the same building during the day, so that means one less car trip, one less time to park. We don't have to send them away to get an x-ray done, have the x-ray read, have them come back for another appointment. They're able to come in, go for their x-ray, come back, and we can look at their images and discuss it together.
5 months after surgery, and I have no pain at all in my heel. In fact, I have started swimming again, which I haven't done for years, and it's actually life-changing. PCI is not new to our family. My husband actually had 2 hip replacements. My dad had knee problems. He came to PCI. My mom had shoulder problems. She came to PCI. We're 100% PCI. We really are.
I think a lot of people come to the doctor with fear about what's going to happen, and if we can make that experience not fearful or not cause anxiety, but actually have a pleasant experience and have an excellent outcome, then we've done them a service.
It's like it never even happened, other than there's a scar there to see, but sometimes I think that scar is a good thing to remind me where I was and where I am now and how thankful I am.